they're seen as, quote, special ed kids and therefore have a stigma associated with it. And then it becomes very demoralizing to many of these youngsters. And we find kids with low self-esteem, feeling badly, feeling like they're broken, something is wrong with them. It's not unusual that I've seen a child turn to his mother and cry and say, I know something's wrong with me. Why do you have to always show me? Or why do I have to be different?
Welcome to Tilt Parenting, a podcast featuring interviews and conversations aimed at inspiring, informing, and supporting parents raising differently wired kids. I'm your host, Debbie Reber, and this week I am talking with Dr. Donna Geffner, a speech-language pathologist and audiologist and renowned expert on audio processing disorder. Dr. Geffner is the author of 5 books and over 300 publications on auditory processing disorders, ADHD, and language disorders in children. In almost 200 episodes of the podcast, this is the first time I'm covering APD. And Dr. Geffner, as a former president of the American Speech-Language Hearing Association, is a fountain of clinical information and research. In our conversation, we talk about what audio processing disorder is, how to recognize it in kids, why it's often misdiagnosed, as well as the best support and accommodation practices for school and at home. This is a fascinating, jam-packed conversation with one of the world's top voices on APD. I hope you get a lot out of it. And now, here is my conversation with Dr. Geffner. Hello, Donna. Welcome to the podcast.
Good. I'm glad to be here.
Well, I'm so pleased to bring you on the show. As I was mentioning before I hit record, I had heard you speak at Tika's conference last month, and I was just kind of blown away by what you shared. And this is a new topic for me and for the show. And so I'm really excited that you were able to come on and share with us today. So just maybe take a few minutes and tell us about the work that you do in the world and who you work with and maybe why you're on a mission to do this work.
Thank you, Debbie, giving me the opportunity. I've spent a lot of years. First, I was a academic. I was a university professor. I was the director of a speech and hearing center and a graduate program in speech language pathology and audiology. But I had an opportunity to work with a number of professionals, a psychiatrist, psychologists over the years, and we've learned that many of the youngsters who wind up with a diagnosis of ADHD have auditory processing disorders. And I began to study this. And it's not a new disorder. This goes back to the 1950s with Hiram Michael Bust, who studied auditory and perception, auditory agnosia. And we saw it a good deal in brain-damaged individuals and individuals with aphasia. But we find that children with no known brain dysfunction can have difficulty understanding what they hear. It's the inability to take in the auditory message, identify it, recognize it, discriminate it, listen under difficult listening conditions, and take it in a timely manner. Even with normal hearing. And what is so, I guess, very confusing to a parent is oftentimes the teacher will say, your child is not listening, or I have to repeat things, or he asks what. And the parent takes the child to the audiologist or to the pediatrician. They test the child's hearing, and lo and behold, the child's hearing is normal. So they send him home and say, okay, well, his hearing's normal. And we don't understand it. Maybe it's ADHD. Well, it can be, because we have a lot of comorbidities with this, but it also could be an auditory processing disorder. And I want people to understand, professionals, teachers, parents, that this exists. This is not a language disorder or can be associated with one, but it is an entity that stands alone as a disorder. And that is the inability to take in the auditory information and derive clarity from it, be able to listen under difficult listening conditions. And according to the American Speech, Language, and Hearing Association and the American Academy of Audiology, we see this occurring in youngsters and adults And they are a heterogeneous group, and often it is a very silent disability because we can't recognize it easily. Youngsters may very well sit in a classroom, be quiet, and not participate. And one of the reasons is that they're just not hearing the teacher clearly. So it usually comes from children who have had long-standing otitis media with fluid or other problems in development, neurodevelopment, immaturity of the auditory system, a myriad of reasons. And in the same token, it can come from parental and familial genetic tendencies, and often we don't always know. But we do know that there is a neurobiological reason for the interruption of the auditory system that reaches the brain. And it's the brain that does the interpretation. The brain is what does the information and processing of the information. But getting the message there requires clarity, it requires speed, it requires integration of both ears and both acoustic hemispheres, auditory hemispheres, in order to do that. And for many youngsters, this is an issue and a problem. And many show up when they reach upper grade, sometimes when the work gets harder or the environment is more noisy and it's more information to process, that we begin to see these breakdowns in their ability to attend and focus and listen. These are your listening individuals who tend to ask what, who tend to say, can you say it again? They need repetition. And many of these youngsters also have reading problems because they can't hear the phonemes. They don't hear the differences in an E and an E of a vowel. So they have difficulty with phonemic awareness skills and decoding. And those are the early building blocks of reading. And reading in the early years is very auditory. And if a child can't make fine discrimination judgments among phonemes or hear differences among a sound or put sounds together to form a word, he or she will struggle to learn to read with accuracy.
Thank you for that. That's such a rich overview of auditory processing disorder. And what I'm hearing and what I gleaned from hearing your presentation too is, this is it's a complex disorder, and it can be comorbid with other things, as you said. You just mentioned that these might be kids who say what a lot or ask for things to be repeated. They might be demonstrating some reading problems. What are some other signs? For listeners, a lot of my audience is parents. And if they are listening to this thinking, I wonder if this is something going on with my child, what are some signs that would indicate it's worth exploring further?
Sure. Well, that's a good question, Debbie. For one thing, many of these youngsters mishear. That they may hear one word and they say it another way, that's what they heard. So we get mishearings. And parents are very much aware. They'll tell me, yes, my child mishears. Go to the car, go to the can, something similar. And that translates to their own speech. They may not monitor their own speech. They may speak more loudly or softly, or they mispronounce words because that's how they hear it. A youngster doesn't know what he's supposed to hear. All he knows is what he does hear. And so many times when I have a youngster in my office and I'm testing him or her and I ask her to repeat a series of words, I can say hen and the child can say then. I can say bird and he can say bird. I can say not and he can hear not without the final sound. So there are incidences that we see where they break up the words, they don't hear it clearly. They do ask a lot of whats. They use eye cues to figure out what was being said. And if they're in an environment where it's noisy, it will only exacerbate the situation. It becomes difficult. And these are youngsters who definitely must be accommodated for and not be placed in a noisy area, certainly away from doors and windows where there's distractions and sounds. But these are youngsters who will quickly turn to where the outside noise is. They're distracted by other sounds. They often will have difficulty locating where a sound may be coming from, which is localization. They might have difficulty processing something very spoken quickly. And I'll often ask a parent, do you find yourself slowing down when you speak to your child? And the answer is yes, because they realize if they speak more slowly, they will be understood better. And yes, these are children, many of whom have what we call temporal processing problems. They don't hear it fast enough. They don't get the message quick enough. And so there's a delay in responding. And many of them will say, wait, what? Or what, wait? Because really they need that extra few seconds to process what they just heard.
Is there a social component to this as well, like a social understanding of their peers' behavior, or what does that look like?
Well, in many cases, when a youngster can't keep up with his same age peers, and we see an overflow from auditory processing problems into some language difficulties. These are kids who don't pick up nuances, sarcasm, because they don't necessarily hear the toning of the voice that conveys that information. They don't pick up on duration characteristics that give information pertaining to a non-verbal message. They might not get non-literal language. They may have trouble with inferential language. But that all comes down to the fact that many of these youngsters don't or cannot keep up with their same age peers in their communication. And so they may not participate as much. They don't have as many friends. They feel or act more immaturely. Or they also do poorly in school, and they may have difficulty with listening tasks and comprehension, not understanding well, having trouble with reading, so they develop low self-esteem. They're seen as, quote, special ed kids, and therefore have a stigma associated with it. And then it becomes very demoralizing to many of these youngsters. And we find kids with low self-esteem, feeling badly, feeling like they're broken, something is wrong with them. It's not unusual that I've seen a child turn to his mother and cry and say, I know something's wrong with me. Why do you have to always show me? Or why do I have to be different? And so children internalize these things, and it impacts their ability to socialize with other children of the same age of that they are. It involves their ability to participate in social activities. Some do withdraw from such, and so they continue to grow, but not with good feelings about who they are and what they're capable of.
I'd like to talk about the diagnostic process a little bit, because as you're talking, it just occurs to me that there are probably many children with auditory processing disorders that haven't been identified as such, or they've been identified as something different. So I'm curious to know, could you tell us a little bit about what the assessment process looks like? When can parents, identify these things in their kids, and just take us inside that process a little bit? Sure.
Well, for one thing, we always must do a hearing test. We must rule out anything that's going on in the child's hearing. And it's not unusual, Debbie, for me when I do a hearing test to find that the child has a conductive hearing loss. That is a loss in the middle ear because of fluid, or because of allergies, or having constant colds, or large tonsils and adenoids, or having sinusitis, which can cause an inflammation of the auditory system and fluid buildup. And when these children walk around with fluid in the ear or negative pressure because of eustachian tube dysfunction, they don't hear clearly. If you have a 20 to 40 decibel loss of hearing, you don't hear clearly. So that's number one. We have to be sure that hearing is normal. And if hearing is normal, it doesn't mean they perceive speech as well. They have normal hearing acuity for pure tones that we test. But when it comes to speech and the clarity of speech, or the figure ground skill, the ability to listen in background noise or competing conditions, that becomes deteriorated. And that's where we start to see the perceptual difficulty, the hearing imperception, which is what is a hallmark of auditory processing disorder. The inability to hear the clarity or be able to listen in competing conditions. So we do test and we provide difficult listening conditions. And one of the reasons we make it difficult is that we try to bring forth upper auditory pathways. We make it more difficult, and therefore we're taxing upper pathways that lead to the auditory cortex. So a child will hear words that are coming in each ear, different words in each ear at the same time. That's called dichotic listening. We can do sentences in each ear at the same time, but now the child has to listen to only one ear and not pay attention to the other ear, and that's a binaural summation effect. It means the upper auditory pathways are being stimulated, and we need to now see how they integrate, how one could suppress the other pathway. We also give the youngster words that are muffled, and we ask the youngster to figure out what the word is. That's a closure skill. And we use internal resources in order to do that. So, for instance, you heard the word ka-e-at. It may come to mind that I said coffee pot, even though you didn't hear every single phoneme. Well, youngsters do this, we all do this, because we don't always hear 100% of the time all the clarity. So we figure out what the word could be, and again, that's a closed technique, and so we test that ability. We test the child's discrimination in quiet and in noise for speech. And we also test the child's ability to take in words that may be staggered, words that are rapid or time-compressed sentences. We also test nonverbally the child's ability to detect when one beep becomes two beeps because it is split by a narrow gap, anywhere from 1 millisecond to 40 milliseconds. Most youngsters certainly can hear a gap between two tones of 20 to 40 milliseconds, but those who have trouble may have trouble hearing the gap and certainly not recognizing a gap that's lower than 20 milliseconds. So that tells us about their timing, their ability to take advantage of small increments in time, duration. We also can test pattern and pitch pattern discrimination and duration of pattern discrimination. That is, it tells us about can the individual recognize differences in pitch or differences in duration, timing, long and short tones, and that's a nonverbal task. And many people really want to, audiologists use that because it's not all about testing their verbal processing skills as well. So we use nonverbal stimuli. Many young individuals out there will test youngsters using electrophysical measures. Well, there's one electrical physical measure that I certainly use, I think we all do as audiologists, is the middle ear and the inner ear. We do otoacoustic emissions, we do tympanometry, we do acoustic reflexes. So those are objective measures of how intact the middle ear is and the auditory nerve. Beyond that, there are audiologists that will do EEGs, electroencephalograms, or do ABRs, auditory brainstem responses, to see the integrity of the auditory nerve. Often, if there is a problem in processing, it could be related to an eighth nerve, which is your auditory nerve, difficulty or dysynchrony between the nerves of both ears. So we look at the function of the auditory nerve, the eighth nerve, and that's accomplished through ABR testing, auditory brainstem response testing, and or what we call middle and late frequency, middle and late amplitude testing to see how the youngster will respond. And this is objective measures because we do it by placing electrodes on various parts of the brain and the ear tip so that we can measure responses to clicks or to speech without the child's behavioral response. There has been incidences where a youngster may come in and act in a way or behaviorally to affect the results of the testing. So there are many audiologists that would enjoy using electrophysical measures which are more objective.
During this month of planning and organization for big transitions, rhythms and routines have been absolutely essential for our physical and emotional well-being. So Green Chef nights are reliably and predictably a good night. We know the ingredients will be fresh and prepped, the instructions easy to follow, and the meal delicious. We're all still talking about last week's turkey tacos with mango chimichurri sauce, refried beans, and Monterey Jack cheese. Green Chef contributes to a healthy lifestyle with easy and delicious menus like fresh seasonal salads and grain bowls. And with over 80 weekly meal and market options, plus rotating options to suit a variety of lifestyles, whether Mediterranean, plant-based, calorie-smart, keto, protein-packed, gluten-free, there are always plenty of options to choose from. Whatever you select, you'll get farm-fresh ingredients, organic whole fruits and veggies, and premium proteins, all delivered straight to your door. I love those 4 words, straight to my door. Oh, and one more thing I love about Green Chef, they have an app, which means it's easy to manage meal preferences and delivery from your phone if you want to. And I, for one, want to. I am in that mode where I'm making the most of little moments like waiting in line at the pharmacy or for the F train to pull into the station to tackle all of those to-dos. So the convenience of an app is key for me. Green Chef has a special offer for Tilt listeners. Go to greenchef.com/tilt50 and use code TILT50 to get 50% off plus 20% off your next 2 months. That's 50% off plus 20% off your next 2 months when you use the code TILT50 at greenchef.com/tilt50. Maybe I've watched too many seasons of The Amazing Race, but every time I have to go somewhere on the subway, I treat it like a competition. It's all about making the right gut decisions about which route will get me there the fastest. Sometimes those decisions get me where I'm going early, and other times my gambles don't really pay off. Probiotics can't help with most gut decisions, but if your gut needs a little support, Ritual has your back. Their Synbiotic Plus, a 3-in-1 supplement, has clinically studied prebiotics, probiotics, and a postbiotic to support a balanced gut microbiome. I've been using Synbiotic Plus for about 6 months now, and it's become a core part of my morning routine. I take the mini capsule every morning while making my way through my inbox, whether I'm at home or I'm on the road, because it doesn't need to be refrigerated. And the capsule itself is delayed released, which helps it survive the harsh conditions of the upper GI tract for delivery to the colon, and that's exactly where we want it to go. Ritual invested in a study modeling the human colon, which showed that Synbiotic Plus significantly increased microbial diversity and the growth of beneficial bacteria. There's no more shame in your gut game. Synbiotic Plus and Ritual are here to celebrate, not hide your insides. Get 25% off your first month for limited time at ritual.com/tilt. Start Ritual or add Synbiotic Plus to your subscription today. That's ritual.com/tilt for 25% off.
So a battery can vary, and we don't have any true gold standard for any set battery, but there are a number of very fine tests out there that are standardized, that are norm-reference tests, that give us a great deal of information, and many times we test youngsters against their same age peers. So if I have an 8-year-old, I know what 8-year-olds should be doing on these tasks, and I measure this particular child's performance against his same age peers. And I derive information as to whether or not that youngster is performing the same or less than or as good as. And that tells me a good deal of information.
And so you mentioned testing an 8-year-old against his or her same age peers. So is there an age that's too young to do this testing or an ideal age?
Well, I think, and I'm very glad you asked that, Debbie, because we don't have any data to refute the myth that these children can't be tested before the age of 8 or 7. It was at one point believed to be the case because we didn't have the instruments or the tests that were normed down to those levels, but now we do. Now we have a handful of tests from age 5 and above, and I was very fortunate to have the opportunity to research this and develop a test with Pearson Publications, which is a worldwide publisher, and studied it for 4 years and obtained data on hundreds and hundreds of youngsters that we can now test kids as early as 3.5, and certainly 4, 4.5, and 5. And what we found is that when children are that young, we know what 3.5-year-old youngsters could be doing, and they can listen in quiet and in noise. We can test speech and noise. And what has come out subsequent to this test, which is called the Auditory Skills Assessment, is some work coming out of Brainbolt's laboratory at Northwestern that says that youngsters who have difficulty discriminating in noise, hearing speech and noise, are often those at risk for reading problems later on, certainly by kindergarten. And the children who have difficulty listening in, quote, the din of the kindergarten noise are those who will have trouble in learning to read. So there's a real connection and association between the skill of listening acutely and being able to read. So my contention is, let's test children as early as we can. We see certain behavior signs. We have tests that can give us information. And if we find a very young child who is 3.5 or 4 who does not perform as other youngsters his age, then he becomes an at-risk child. And we do things to help him. We do things to intervene. We build up those listening skills, those early reading skills. So by the time the child reaches kindergarten, he will be functioning like his same age peers. And we haven't lost valuable years of neuroplasticity. And neuroplasticity is a very critical concept. The brain is plastic. It's plastic throughout life. So we know that you can teach old dogs new tricks, but it's more plastic when it's a younger brain. And the earlier we get to these youngsters, the better the remediation, the faster, the quicker, and the more efficient. So my soapbox plea is for those teachers and preschool teachers and parents who see youngsters struggling with auditory information and taking in auditory information, who need a lot of repetition, are youngsters who should be at least screened to see if they have any auditory processing problems so we can do something about it.
And so I'm wondering, you mentioned earlier about accommodations too. So it sounds like the earlier, the better in terms of tapping into a child's malleable brain and making some real changes there that will help them be more on track with their same age peers. What kind of supports and accommodations might we suggest for in the classroom for kids with auditory processing disorder?
Well, for one thing, we want them to be seated properly away from doors and windows and noise machines. One youngster I saw last week, they put him near the air conditioning unit and he couldn't function in the classroom. So we want to avoid that. We want them to be away from noisy other children. And of course, the smaller size class is better. We can't always achieve that in a public school system, but the smaller class, the closer the 1-to-1 ratio of a teacher to student is always preferred. And if it can't be, we do have sound enhancement systems. We do have fabulous FM systems that can accommodate these youngsters, because what that individual does is wear either a set of headphones or small little behind-the-ear aids that look like hearing aids, and they're little FM units, and the teacher wears a microphone, and they hear the teacher's voice as if the teacher's talking to him or to her directly. It blocks out background noise. It brings the signal in clearer, and so the youngster now can hear clear speech. There is no substitute for the need to hear clear speech. It's as if the child who has a visual problem looks at the board and can't see the letters. Well, we put glasses on his eyes, and now he can see the board. He can read the letters. He can read the words. So the child who's wearing an FM system, either through a sound enhanced system or an individual unit, through headphones or binaural FM aids, can now hear clearly, can even monitor his or her own speech, can help with phonological awareness, skills for reading, and be able to follow directions and be less embarrassed to have to ask the teacher to repeat. It makes it so much easier, and there's less listening fatigue. There's less teacher fatigue. In other words, the teacher doesn't have to repeat as often or raise her voice. It also establishes better eye contact for the youngster. So we have lots of great data about the use of FM systems. One of the important data points is not only better attention and focus, better eye contact. Children know who to look to. Children are able to process language better. So we do see this. And we also see, as a result of PET scan studies of the auditory cortex, that if a child wears an FM system over time, it's usually a school year with a 6 to 8 hour school day, and wears it consistently, we see more activation in the left temporal lobe area, which is your ultimate prime area for reception of sound, so that part of the brain gets stimulated and thus results in better hearing over time. So wearing an FM system is not just a management approach for the child to hear better at the moment. It is a therapeutic approach in that it improves the auditory system. And I think once I explain that to parents or teachers, I think there's a greater emphasis on wearing it and wearing it consistently.
You mentioned earlier that auditory processing disorder can often be comorbid with ADHD. And I'm wondering if in your practice or in your experience, you've seen students come in who have been misdiagnosed with ADHD when it's really APD.
Yes, that is true, but then we can't negate the fact that it's not necessarily either or. Years back when I was a university professor and I had the wonderful help of grad assistants, we looked at over 425 files of individuals who had auditory processing disorders in my caseload. And we found 42% of them had diagnosed ADHD. And another 42% did have attention factors, but not necessarily diagnosed because either they were not seen by a psychiatrist or psychologist, but their symptoms were presented as if they had attention deficit. So that's about, if we wanted to add it up, we've got like 84% hit rate. Now, I will say that a published study by Sharma et al. In the 2006 in Journal of American Speech Language Hearing Association Journal of Research did indicate that when she looked at 100 children who were diagnosed with central auditory processing disorder, only 4% of that population had no other comorbid condition. And the most common comorbid conditions were reading disability and ADHD. Now, the way I like to differentiate it is ADHD is a problem in self-regulation. We often see a lot of executive function problems. So if a youngster comes in and has difficulty and they have very shared common symptoms, that is, the child with ADHD will not necessarily pay attention to auditory stimuli, will easily be distracted by auditory stimuli, will ask a lot of whats, will say a lot of wait, what questions. They need repetition, so they present with very similar symptoms. But the way I differentiate it is that there's an organizational characteristic to ADHD. These are kids who can't self-regulate, poor organizational skills, difficulty in prioritizing, difficulty in finishing or initiating a task. And a child with an auditory processing disorder doesn't necessarily have these behavioral symptoms. They may, but it is not a primary symptom of their disorder. So there are differences. Sometimes I can tell when I call a parent to schedule an appointment. I hear the youngster in the background crying or saying, I need you, asking for attention, being disruptive, and therefore we have more of attentional or behavioral issues going on here. But they can occur. They can both occur.
Yeah, so interesting. I'm always trying to put myself in my listeners' minds to see what questions they would want to ask. And I think that there are parents who have kind of like a laundry list, right, of diagnoses or identifications for their kids. And so that's really helpful. Hey there, it's Debbie. I love making this show and sharing conversations about how to support our awesome neurodivergent kids. I've seen how even one little insight from an interview can spark a big shift in daily life. But I know that raising complex kids can be messy and lonely. And just when we think we figured it out, something comes up that boots us right back to feeling overwhelmed and stuck. That's why I've poured everything into creating a way for parents like us navigating complex parenting journeys to join together and chart a path that feels positive, hopeful, and doable. It's the brand new Differently Wired Club experience. In the club, you'll get personal support from me and other seasoned parent coaches, 6 live calls every month where you can connect and get your personal questions answered, the opportunity to learn directly from authors and experts like I have on this show, monthly themes for getting specific and tactical, an exclusive private podcast feed, and the best, most generous community of parents. Seriously, these folks show up for themselves and each other, and that right there is really everything, because it's a daily reminder that we're not alone. Our kids aren't broken, and we have totally got this. The recently rebooted Differently Wired Club is on a brand new platform with its very own iOS and Android app. It is such a great space. However you learn, whatever your style, no matter the ages, genders, and neurodivergent profile of your children, the Differently Wired Club can help you cultivate the positive shifts you're hoping for. Join us today by going to tiltparenting.com/club. That's tiltparenting.com/club. I hope to see you on the inside.
Are you overwhelmed by the things that get in the way of you doing what you want to do? Are you looking for ways to simplify life to better align with your values? Do you want to create space in your schedule so you have room for more of the good stuff? Play, joy, relationships, gratitude, and more? If you answered yes to any of these questions, I invite you to check out Edit Your Life, a podcast to help you edit the unnecessary from your life so you have more room to enjoy the awesome. Through episodes with me, Christine Coe, and a range of super smart, compassionate, and thoughtful guests, you'll come away with big picture insights and practical ways to declutter your home, schedule, and mental space without getting bogged down by perfection. I have always believed that small moments and actions matter tremendously. My goal is to help you find agency and space in your life through doable baby steps that will leave you feeling accomplished instead of overwhelmed. Check out Edit Your Life wherever you enjoy your podcasts.
Let me ask you one last question. For parents who are suspecting or they know that this is going on with their child, we talked about accommodations in the classroom. Is there anything that parents should be aware of or can work on at home with their kids to support them?
Yeah, and Debbie, I didn't mention, which I should have a minute or two ago, is that speech-language therapy is wonderful for remediation. And these are youngsters who have a phonological processing disorder. That is, they can't blend sounds together, can't tell you how many sounds they hear in a word, can't manipulate sounds, can't know when a sound is being deleted or added. And these are what we know as parents may know as phonics. Those can be taught. That's a very successful therapy program. There's some wonderful programs out there, the phonemic synthesis program, wonderful programs in CDs that have been developed to work with these skills. And youngsters do get better. They get better. There's other skills that can be trained through speech and language services. And I will say that often if we find a kid with an auditory processing disorder, we really should look at their language skills, receptive and expressive. Many youngsters have weak comprehension, inability to understand what was said to them. And that too can be trained and developed and improved upon with a speech language pathologist. And in addition, or in concert with a speech language pathologist, we often have wonderful web-based programs. Today, lots of programs are on the web. Programs like Fast Forward, which works on temporal processing and attention and sequencing, memory, decoding. Youngsters who are on it, and it's a concentrated program. You do it 5 out of 7 days a week for 30 minutes a day over several weeks to several months. You can do programs like CapDots, which work on dichotic skills and integration. There's other CD programs out there, like from the Pair Builders, phonological awareness, aerobics. If people still have the program and the computer compatibility with that. Lots of good apps out there, Pocket Phonics and Pocket Phonics sentences. So there's lots of programs that will build up the auditory skills for phonics, following directions, working on discrimination skills, working with a speech-language pathologist on listening better in noise and figure ground skills, and then ultimately on language skills. Keep in mind, many of these youngsters, because they don't always get the message clearly, don't always use appropriate social language. They don't always pick up on nuances or sarcasm. So that's where a speech-language pathologist can play a role in helping that youngster to make those discriminations, judgments, and to understand when something was said sarcastically as opposed to a real answer. So helping that youngster make those discrimination judgments is very important in a therapeutic approach.
Fantastic. Thank you for that. So, first of all, I feel like there are a ton of resources that I want to share with listeners. So, listeners, I'm going to make sure to include everything that Dr. Geffner has mentioned in the show notes pages. But are there any other resources that parents listening need to know about that you didn't cover?
Yes. Well, for one, I think they should know about our national associations. The American Speech, Language, and Hearing Association does have a guidelines. You could go into their website, asha.org, under consumer and pull up information about auditory processing disorders. The American Academy of Audiology also has a website. One can pull up information for the consumer about auditory processing disorders. There's the IGAPS group, International Group of Auditory Processing Specialists, that do communicate. I'm on their wonderful listserv, and so we talk to each other all over the world, and we share our experiences and our knowledge, and it's become a true community of those of us who do auditory processing testing. But there are other, CDDC, the Center for Disease Control has information on it as well. So there's my website, drdonnageffner.com. I do have a section about it. And we also have another website on auditoryprocessing.com that both a co-author, Dr. Deborah Swain, and myself have produced. So we have information out there on the web that can be helpful. I also have a textbook, Auditory Processing Disorders, Assessment, Management, and Treatment, which I have to say I edited. I didn't write the entire book. But it's a wonderful compilation of chapters written by experts all over the world about auditory processing. But we have other wonderful textbooks out there, works of Muziak and Shermack's textbook, other workbooks by other authors that have studied this area and have taught us a good deal about auditory processing. Bellis has done wonderful work with that, and work coming out of the University of Massachusetts chairman, who has been a wonderful resource for these areas as well. So there are lots of wonderful authors and writers and researchers that give us new information every single day.
Fantastic. Thanks for sharing those. And again, I will list these on the show notes page. But for now, I just want to say thank you so much for coming by and sharing with us. Again, this is a new topic for the show, which at 180 plus episodes is not something I say very often. So I really appreciate you sharing with us today and telling us more about your work.
Well, thank you. I'm glad I had the opportunity. And also, I don't want to neglect the fact that we often have many of these youngsters are TECA. They are twice exceptional. They could be bright. They could be competent youngsters, but they also can have some perceptual difficulties which put them into that category. So thank you for giving me the opportunity to share information and to provide enlightenment to people out there who may have questions. So I'm very grateful to you too, Debbie.
You've been listening to the Tilt Parenting Podcast. For the show notes for this episode, where you can download the transcript and grab all of those links for the resources that Dr. Geffner shared with us, just visit tiltparenting.com/session196. If you get a lot out of Tilt Parenting and would like to make a small monthly contribution to help cover the production costs, it is really easy to do. Just go to patreon.com/tiltparenting and sign up. You can pledge $10, $5, or even just $2 a month. Again, that's patreon.com/tiltparenting, or there's also a link on any of the show notes pages on the website. Lastly, don't forget to subscribe and leave a rating and a review for Tilt Parenting on iTunes. Those ratings and reviews help keep this podcast visible in an ever-growing sea of podcasts. Thanks so much. And that's all for this week. For more information on Tilt Parenting, visit www.tiltparenting.com.
If you're a parent, I invite you to join us at the Mindful Mama podcast, where it's all about becoming a less irritable, more joyful parent. With sometimes hilarious and always thought-provoking experts and friends, at Mindful Mama, we know that you cannot give what you do not have. And when you have calm and peace within, then you can give it to your children. I'm Hunter Clark Fields, and I can't wait to see you there. Listen in to the Mindful Mama podcast.